Hi, I'm Dr. Ross Jenkins with Caldwell Foot and Ankle. I'm here to talk to you today about bunions. Bunions are they're really a hereditary deformity that are exacerbated by shoe gear. You know, everybody keeps talking about their shoes being cramped up or their toes being cramped as a child. But typically what matters with a bunion deformity is if it's painful or not. You know, we have people in our clinic that will travel along a direction for bunions and they come in and if they don't have pain, we won't mess with them. And it's just because if it ain't broke, you don't fix it. It's kind of a simple way to look at it. But a bunion deformity is essentially, if we're looking at a foot model here, a bunion deformity is a bump that occurs on this side of the toe. Now, people will get pain from two different things. One, there's a large nerve, or not a large nerve, but there's a nerve that crosses right on the inside of the toe, and it's called the medial propredigital nerve. And if that toe leans over, there's tension on that nerve and it hurts with shoes. The other one that I become more concerned about is people get joint pain. It's an aching pain and they get it at nighttime, and that means that the cartilage is beginning to erode. But where the bunion occurs, we'll get a separation between these two bones. It separates and the toe begins to lean over. And as we're walking with time, is if the calf muscle's tight in the back, the foot's rolling out, all of a sudden this becomes hypermobile. And if it's become hypermobile, it will begin to move up, and then we'll see a separation of the joints. Now, if you develop pain, the sooner we actually fix a bunion, the better it is, because what happens is we can fix bones, but we can't fix cartilage. We cannot replace cartilage. And so now what we want to do is put the toe back into alignment. And what that does, we can actually move cartilage. If the cartilage is twisted, we can straighten the cartilage up. And it also is a variable on the type. You know, I have people come in and says, well, if I fix it sooner, or if I'm not really hurting, the surgeries are harder. Well, of course the surgeries are harder, but again, you don't want to do surgery on somebody that's experiencing no pain. The way I kind of look at it, and the way I explain to most people, if your pain's a 7 and I make it a 1, that's a successful surgery. If your pain is a 1 and it's still a 1, but it looks better, it was kind of a wasted risk. And if you have no pain and it's a 1 and it looks great, now you're mad because you have pain you didn't have pain before. So essentially, I don't really care the difficulty of the procedure. It's just a matter of doing what's right for you. So there are variables in the procedures that we do. Some procedures are just simple bumps where we just shave the bone off, and that would be somebody that has bump pain. We have procedures that are done up in the forefoot of the toes up in this region, and if we do it up in there, typically we have you walking in 5 days. And some of the procedures have to be done in the back. And if they're done in the back, we're typically non-weight bearing for 4 to 6 weeks. And on the bottom of the foot, when we look at this, the reason we do bony correction, there are 2 bones on the bottom of the foot, and they're called sesamoids. And what will happen is if the sesamoids get out of position, if we kind of cheat and make the toe look straight, but these 2 bones are not in the right position directly under this bone head, what will happen is the bunion can return. So what we want to do, we want to make sure in the surgery that we put this bone back on top of these 2 bones. And as we do that with whichever procedure that we do, you know, the idea is to do what's best for you, so we do not have to go through this procedure again. You know, nobody wants to go through those. And then the only other reason that I'll explain is the fact that the non-weight bearing is just the fact it's called a lever arm effect. The further you get away from the end of the toe into the region of the midfoot, the easier it is if you're walking too soon to deform the foot. And so we don't want to deform the osteotomy that we did because we put it in the proper place in the operating room. It typically takes bones anywhere from 6 to 8 weeks to heal, and then soft tissues is 6 weeks as well. So we really want to try to preserve that. So, you know, if we are moving early, then we're looking at range of motion boots, and in some cases it's even casting. But again, it's a one-time surgery for the rest of your life, and that's what the primary goal of treatment is. And it's interesting with bunions. Bunions, typically people have more pain in the winter, and of course that's shoe gear, right? Because what will happen is the shoes will put pressure on the bunions. They'll come in the summertime wearing sandals and they don't have pain, and it's just because of the joint placement. So today's topic was bunion deformities. I'm Dr. Ross Jenkins with Caldwell Foot and Ankle.